Occasionally, we have to talk about patients being too heavy or weighing too much to safely undergo hip and knee replacement surgery. But is there such thing as a patient not weighing enough? Well, a recent study suggests yes. This study looked at BMI. Now remember, BMI, or body mass index, is a calculation of your height and weight. You can Google BMI calculator and come up with several reliable tools that will give you your own BMI. This study looked at BMI less than 20. So these patients were considered light or malnourished. And what they found was if your BMI was less than 20, you were at increased risk for surgical complications like infection and delayed wound healing, much like those patients with a BMI over 40, which are known to be in the class of stage 3 obesity and have increased complications, particularly infection, after hip and knee replacement surgery. So what did we learn? Well, we learned that there's an ideal range to sit in to minimize your complications after surgery. I hope this is interesting to you. I hope it generates some discussion. If we can help in any way, reach out. You guys have a great day.